Welcome to The Explainer. Today, we're going to talk about that nagging, frustrating tendon pain. You know the kind. It sticks around for months, maybe even years, and it just doesn't seem to matter what you do. Well, it's a stubborn problem, and we're about to explore a pretty fascinating way to finally fix it.
Right. If you've ever dealt with something like tennis elbow, or Achilles tendonitis, or plantar fasciitis, you have definitely asked yourself this question. You rest, you do the exercises, but the pain just comes roaring back. It really can feel like you're stuck in this endless loop.
So to get to the bottom of this, we've got to look at what's really happening inside that painful tendon. And as it turns out, the way we usually think about this kind of chronic pain is actually wrong.
Okay, this right here is the key. We often call it tendinitis, and that itis at the end means inflammation. But for pain that's been around for months, the right word is tendinosis. And this isn't an active, inflamed injury, no. It's a chronic state where the tendon tissue itself has started to break down, and your body's natural healing process has basically just given up. The repair crew is packed up and gone home.
And this whole failed healing thing is exactly why the standard treatments don't always work. For about 1 in every 5 people, rest, ice, and physical therapy, they just aren't enough to break the cycle. It leaves them stuck, needing a much more direct approach.
So what if we could just force a reboot? What if we could tell that repair crew, hey, get back to work? Well, that's the whole idea behind a fascinating and, honestly, surprisingly simple procedure.
It's called percutaneous needle tenotomy, or PNT for short. And the concept is just brilliantly simple. A doctor uses a small needle to repeatedly poke the damaged, degenerated part of the tendon. It's kind of like tilling hard, compacted soil to get some air in there and allow new seeds to grow. The goal is to turn that chronic, failed healing state back into a fresh, acute injury that your body actually knows how to fix. So the procedure itself is guided by ultrasound, which is pretty cool because the doctor can see exactly where that unhealthy tissue is. Then, they insert the needle and create a bunch of tiny, controlled injuries. And this micro-trauma, that's the magic. It sends a powerful signal to the body, basically screaming, hey, we've got an acute injury here. And that brings in fresh blood, growth factors, and kicks off a brand new healing cascade.
This idea of restarting the healing process has been a total game changer. But, as always, a newer technology came along and took it one step further, asking, what if we could also clean out the old damaged gunk at the same time?
And that's where a procedure called 10X comes in. It uses a special device that does 2 things at once. Just like PNT, it triggers that new healing response, but, and this is the big difference, it also uses ultrasonic energy to break down the bad, degenerated tissue, which is then immediately suctioned out. So think of it as not just calling the repair crew back, but also clearing away all the old rubble so they can do a much better job.
Okay, so this all sounds great in theory, but does it actually work? Let's dive into the evidence and see what 2 recent big scientific reviews found when they looked at all the available research. All right, the strongest evidence by far is for elbow pain. A lot of the studies have focused on tennis and golfer's elbow, and the results for patients who haven't gotten better with anything else, well, they're consistently really positive.
Now, I know this chart looks a little complex, but the story it tells is super simple and pretty powerful. Each one of those lines is a different study. On the left, you've got the pain score, 0 to 10. Before the procedure, look where everybody is, way up at a 6, 7, even an 8. But now, just follow those lines over time. Look at that drop. In almost every single case, the pain plummets down to a 1 or a 2. I mean, that is a life-changing improvement.
And this slide shows the exact same story, just in a different way. This one averages the results from another major review. See that first bar? The average pain score for elbow patients started at nearly 6. A year after the 10X procedure, it had dropped all the way to just over 1. And maybe even more importantly, those scores measuring how much the pain messes with your daily life, they also fell to almost 0.
So while the elbow has the most research, the great news is that these procedures are showing really promising results for other stubborn problems too. We're talking common issues like pain in the gluteal tendons of the hip, the Achilles tendon, plantar fasciitis, and patellar tendon pain in the knee. The body of evidence is still growing here, but the early results are looking very, very encouraging.
So, after looking at all this data, what's the big picture? What's the key takeaway for someone who's really suffering from this kind of chronic tendon pain?
Well, the conclusion from the most recent scientific review really sums it up perfectly. It says that both PNT and 10X are safe and effective for, and here's the important part, tendinopathy refractory to conservative treatment.
All that really means is it's a great option for people whose tendon pain just hasn't gotten better with the standard stuff like rest and PT.
And that word safe is really important. Across all the studies they looked at, the rate of serious complications was incredibly low. The most common side effect was just some temporary pain from the procedure itself, which kind of makes sense, right? You're intentionally trying to trigger a healing response.
Now, it is also super important to be clear about the limitations of the research we have right now. Most of the studies are what scientists call lower-level evidence. They're often small, and they don't have control groups to compare against a placebo. So, all the researchers agree we definitely need more big, high-quality studies to be done.
And all of this brings us to the real bottom line on where these treatments fit in. They aren't a starting point. They're meant to be a critical bridge for patients who've already tried things like physical therapy without any luck, but who really want to avoid a much more invasive open surgery.
And this leaves us with a really fascinating question to think about. For so many chronic conditions where the body just seems to have lost its way, maybe the best solution isn't to soothe the area, but to intentionally provoke it, to trigger a controlled healing crisis that forces the body to finally finish a job it started a long, long time ago.